Hello. This is part 2 of my mastectomy series. The first part is already posted and it talks about some of the products that I have that will kind of help me with my mastectomy recovery. This part 2, is going to cover why I'm getting the mastectomy and the type of mastectomy that I decided on. So let's start talking about why I'm getting this mastectomy. The long and the short of it is that I am high risk. What does it mean to be high risk, right? How do they deem high or low risk? And for me, the doctors determined it 2 ways. The first way was with my family history. So my mom and 2 of my aunts developed breast cancer around the age of 30, which is a huge red flag. And then once we figured that out, I was genetically tested to see if I carry a genetic mutation in either BRCA1 or BRCA2, which are 2 genes that, when mutated, increase your likelihood of developing breast cancer in your lifetime. It does also affect your likelihood of developing other cancers like colorectal cancer, skin cancer, ovarian, cervical cancer, things like that, but breast cancer is the biggest one. I think by the time I'm 40, I have upwards of an 80% chance of developing some form of breast cancer. So I was not a fan of those odds. So my family history and my genetic susceptibility told my doctors that I am very high risk for developing breast cancer. I kind of had 2 options from there. I could either leave the way that I was and just get more frequent screenings like frequent mammograms, or I could opt for a preventative surgery, in this case a mastectomy. So seeing what my mom and my aunts went through with chemo, radiation, stem cell transplants, I decided that I would want to take the proactive approach and get a prophylactic or preventative double mastectomy. So that's sort of the why of why I'm getting it. It does seem kind of weird, like, you know, I'm healthy, I'm fine now, why am I getting such a big surgery? It's to prevent me from developing breast cancer, which at this point in my life is very likely. So I decided to get a mastectomy, and then the biggest thing that I had to do next was decide what type of mastectomy to get, because especially for preventative, when you don't have any restrictions on, you know, what needs to come out, there are a lot of options available. So I'm kind of going to talk about the options that were given to me and why I didn't pick them, and then I'll kind of talk about the option that I did pick. There are sort of 3 main options that I was given. And the first option was no reconstruction. So this option, from what my doctors told me, is more common among older women because it's so low maintenance, right? You're not really looking to maintain a certain aesthetic. You just kind of want to get it out and get it over with and kind of go about your life. So this is pretty much what it sounds like. They perform the mastectomy, they take all the breast tissue, and they sew you up flat. So there's absolutely no contour, there's no breast shape or anything. It's literally just flat, and you have scars that go across like this. I did really heavily consider this option, actually, because I am a very low maintenance person. I didn't like the idea of having to think about going in for checkups or getting my implants replaced or anything. And the shorter downtime was sort of enticing. The reason that I didn't pick this option is because as much as I would like to think that I am, you know, strong and capable and awesome and firm in my femininity and my identity, I'm really not. And it was really hard to admit that to myself. But I'm not. So I knew that if I didn't get any reconstruction, sure, it would be low maintenance, but I would struggle even more with my body than I already do. And it would be really hard to convince myself that I was still feminine and attractive. So I would really like to think that I'm strong enough to do that, but at this point in my life, at least, I just didn't think that it would be good for me emotionally or mentally. Now is not the time. The second option that was given to me is, I guess you would call it a little bit newer, but the foundations of this surgery have existed for a really long time. And it's called DIEP flap. and DEEP is an acronym, DIEP. I did have to look this up. My doctor did tell me, but DIEP is an acronym. It stands for Deep Inferior Epigastric Perforators, which is a procedure that takes your lower sort of stomach fat or abdominal tissue, as well as blood flow, blood supply, from your own abdominal tissue, and uses that to reconstruct your breasts. So it's your own tissue. It will feel more natural than implants would. And there's also no chance of rejection because it's your own tissue. Although the results were something that I was interested in, I really did not like the idea of making a surgery even more invasive than it needed to be. Because with the DEEP flap surgery, you will have a scar that goes all the way from hip bone to hip bone. And not only will you be healing up where your breasts were reconstructed, you're also healing from what is essentially a tummy tuck. So it kind of two places at once, which really did not seem ideal to me. It's just not something that I wanted to do. The third option, and the option that I ultimately went with, was I suppose the most common one, which is a nipple-sparing double mastectomy with implant-based reconstruction. And it's exactly what it sounds like. So for this surgery, they'll make the incision underneath my breast. They will not go through my nipples. The different incision types can go through the nipples or remove the nipples. Mine will be spared, and they will go in underneath my breast to take all of the tissue out. From there, you can decide to have your implants over the pectoral muscle or under the pectoral muscle. It is a little bit more protection to go under the muscle, because once you remove the breast tissue, there's literally nothing except skin. And then, you know, the implants if you decide to go over. My doctors and I kind of went back and forth between which one to get. I am young enough and healthy enough that it's likely that my skin would be good and viable to get the implant over the pectoral muscle, but I think I'm going to go with under the muscle just to have that extra layer of protection. So that's the type of reconstruction that I'm getting. Honestly, there are so many options, and it's nice that there are so many options because everyone is different in their preferences. The reason that I gave for not getting DEEP flap or no reconstruction could be someone's reason for getting that surgery. It really just depends on not only your preference, but what is safest for your body. So definitely talk with your doctors if you're curious about any of this. I did my best to not misinform with anything, but I would definitely still do your own research and talk with your doctors to be sure. So I hope that this helps kind of clarify some stuff. I will try to make another video relatively soon when I'm packing for my hospital stay. I'm only staying for about 24 hours. So I hope that you'll take a look at that as well when that's up. But for now, I'll see you guys later.